They suffer depression, they feel lonely, then sometimes they have anger issues, they have loss of memory, cognitive issues. So all these are also after effects of the surgery. People tend to see all those videos on YouTube, like 5-minute workouts and 10-minute workout, and they go into vigorous workouts.
Yeah.
But when you have a heart issue, when you know your BP is not stable, when your respiration is not stable, you need to do all these things under monitoring.
People born to parents with heart disease, both father and mother, they have 50% chance of developing heart disease after 40s.
Just 10 minutes of meditation throughout the day is very good technique, to relieve stress. So people are doing sitting aerobics. They are sitting on their chair and doing the aerobics. You don't even have to get up and do. So these are simple things which people can do. People just want to follow the film stars. They go on crash diets. They go on crash body workouts. These things don't work for normal individuals or for individuals who have undergone such surgeries.
Mental health is as important as physical health.
Yes. Nowadays, people talk a lot of me time. But me time is like they go out and sit with their phones. That is not the me time.
Your heart's journey doesn't end after a heart attack. In fact, that's often just the beginning of a new chapter. Hi, I'm Jagu and welcome to the Good Doctors podcast by Zynova Shalby Hospital. In today's episode, we're diving deep into life after a heart attack. What happens in those critical weeks of recovery, what mistakes should you avoid, and most importantly, how can you avoid a second heart attack? Joining us today are Dr. Krishnarao Bhosale, a cardiovascular surgeon, and Dr. Dhara Parekh, an experienced physiotherapist who has helped countless patients regain strength and health. We'll be covering everything from physical and mental aspects of recovery to the lifestyle changes and cutting-edge research that can change your heart health for the better. Let's get started. Dr. Dhara, Dr. Bhosale, thank you so much for doing this with us. Dr. Bhosale now is pretty much our reference point because he's been on previous episodes, and it's a pleasure to have you here, and we're hoping that you also will find it interesting. I know that the last few episodes for us have been enlightening, like it's almost like new information that we're getting. And even though we read about this stuff, the point is we read as lay people, and even the material sometimes might not be necessarily medically correct. And here's a large part of what we're doing on this podcast is that we're differentiating actual medical science from what we look, hear, see, feel, and sort of sometimes get it wrong. So this is an important element. One of the things that we do want to focus on is, we've covered so much material already. One of the things that we do want to focus on is the life after perspective. And there's so much about life after that is important, including the different type of surgeries, treatments that one has gone through. An angioplasty is different, a whole bypass is different, any sort of intervention is different, and there are different categories for how you need to take care of yourself after that. So, Dr. Bhosale, let me come to you with this. The first few weeks after a heart attack are pretty much critical, but often one leaves the hospital and says, okay, we're good. That is a fundamental mistake, is it not?
Yeah, I think here we must understand one thing. When we talk of heart attack, we have seen in earlier episodes why the heart attack takes place.
Yes.
What are the various factors which are responsible for aggravating the occurrence of heart attack? The second thing is when any individual comes to us in hospitals for treatment of heart attacks, it is a lot of physical, mental stress for the individuals, for the relatives. And we, on the medical side, have a variety of therapeutic options. Medicine remains the mainstay. We have different types of heart medicines which are used for treating these heart attacks, but at the same time, medicine is not the only thing. We have to consider further modalities of treatment like angioplasties or in few cases bypass surgery. This is all to alleviate or improve upon the patient's heart status.
Sure.
So once we have done these modalities of treatment, when the patient is ready for discharge, the essential thing to understand on the part of the patient and the relatives is they must take care of the factors which have precipitated this episode of heart attack. So they must understand the various risk factors which have caused it in that given individual.
Is that always diagnosable? Because sometimes it's just unhealthy eating habits, sometimes it's stress.
No, there are multiple factors like hypertension, blood pressure है, diabetes है, high cholesterol है, sedentary lifestyle है. So there are multiple areas which need to be looked into as what we call secondary prevention.
So what should they be looking at as soon as they're discharged, so that at least that recovery phase from whatever procedure or surgery they might have undergone?
The recovery phase, important thing after heart attack, we must give at least 4 to 6 weeks of adequate rest to the heart so that it does not suffer further in terms of its function. That is one. Second thing is the recovery of heart is a slow process. There is what we call swelling, myocardial swelling, which takes place. And for that swelling to settle down with a recovery of pumping function of the heart is going to take 3 to 4 weeks.
Sure.
It is this time where the stress factor should be avoided. When we talk of stress, it is not just physical stress, it is mental stress. Then there are few other habits like eating high salt diet, that these things must be avoided.
Fair. Dr. Dhara, let me come to you as a physiotherapist. When somebody comes out of a procedure or an intervention or a surgery of this scale, it's not just the heart one has to worry about. It's almost a whole body situation. What should they be looking at then at the recovery process, right after they've stepped out of the hospital?
So, in I think India, it's the conventional way thinking that, once the surgeon has done the work, when the cardiologist has done his work, so we are fit and fine out of the hospital.
I'm brand new.
Yeah. So they don't realize that there are a lot of other things happening in the body which they need to take care of. So, sometimes in the ICU, when we see patients, a simple thing like getting up from the bed is also very difficult for the patient because your breathing is affected. You have a surgical intervention done, you have pain, you have all those binders, drains. So all those simple activities of breathing also becomes difficult for the patient. There are issues like hyperventilation, they might go into tachycardia. They might become breathless anytime. The stamina is low. So even if, they're just moving their hand, taking something and coming back, that also will be a very tiring act for them. It will be like a great effort they have to put in for that. Strength, of course, they reduce on that part. So it's the overall body function, even coughing, removing, secretions from the body also becomes a very difficult act because of the surgery, because of the pain that comes into picture, even swelling in the feet because they have not been moving. So there is fluid retention in the body.
Is this as simple as what I would call as a layperson weakness, or is it more than that?
Weakness would be just that they're not able to use their muscles well for doing. That can be in any case. It could be, joint pains also can lead to weakness, or age-related degeneration can also lead to weakness. But this is basically because your heart is not working at the fullest capacity, the full capacity. So because of that, all other body organs are affected.
Sure.
Okay, if your heart is not providing oxygen to the body, your intestinal organs will be affected, your lungs will be affected, your muscles will be affected. So it's an overall body which is affected just because one heart is not functioning to its fullest capacity. So plus this is the body physical symptoms that we see. Other than that, there are emotional factors.
Yes.
Okay, people suffer anxiety, they suffer depression, they feel lonely. Then sometimes they have anger issues, they have loss of memory, cognitive issues. So all these are also after effects of the surgery. Secondly, they have secondary infections.
Ah.
Like after the surgery, they might get some infection of the scar tissue, or they might land up with some fluid accumulation in the lungs.
So this is not just a low immunity situation. What you're talking about is more than that.
Yeah, definitely. See, if it's just a low immunity or weakness, it could be related with other issues also, like orthopedic conditions, or if a person has got stroke, that also will come with weakness, or basically degenerative old age changes, that also can lead to weakness. But
Sure.
this is something because the heart is not working at its fullest capacity. So heart is supplying blood to all the other organs of the body. So your lungs will be affected, your intestinal organs will be affected, your brain will be affected,
Yes.
all your functions, body functions, musculoskeletal system will be affected. So it's an overall affection of the body. Plus they have emotional factors also. So people after surgeries or after heart attacks, they have complaints of anger issues, they have emotional disturbances, sleep disturbances, they feel lonely, they feel anxious, they are scared, there's a lot of fear in them. So all these issues come up. Along with them, they have sometimes secondary infections because of the surgical wound that has been created. There could be swelling in the feet, so people might develop thrombosis, and sometimes they have clots formed in the body. So all these things also need to be considered, because these things will not be just tackled with the surgical process being done.
Sure.
So these are something which we have to tackle after the surgery is done.
Fair enough. So, Dr. Bhosale, I want to go ahead in the timeline a little bit with this. We addressed what happens on a cardiac basis as well as on a full body basis right after the surgery. But that's not where it ends, right? It's not a 4 to 6 week process.
No.
What happens after in terms of what a patient should be doing and errors that they should be avoiding?
See, when we talk of treatments, the treatment is not just to relieve an individual of one disease at one time. We want the individual to regain or reestablish well-being, to live an active, fruitful life, preferably to the same extent as he or she was enjoying before the episode of the ailment.
Yes.
So when we look at this as a rehabilitation program, rehabilitation is a word very commonly used in multiple areas of our life. But here in medicine, when we talk of rehabilitation, is re-establishing wellness of the individual in terms of physical, mental, social, professional or occupational
Yes.
well-being. So
Yes.
you imagine you have so many areas for an individual to be re-established, to give him a adequately fruitful, active life.
To be able to recover his quality
Yes.
of life.
So many areas you have to consider after the patient has settled out of his ailment for that given time.
Sure.
So, talking about the physical part, I think Dr. Dhara is here. She is expert in physiotherapy.
I did want to get into that. So we're talking about cardiac rehab is one thing, but there's people, I would assume that they're told they have to do rehab, but then वो छूट जाता है, and I'm sure you've dealt with this.
Yes, true.
What happens in the body when you're undergoing physical rehab versus when you're not undergoing it? What differences emerge?
So I'll give you a very simple example. If there's a sports player, okay, he's injured his ligament, he's undergone some surgery, okay. So initial 6 months, the doctor will tell him, you have to rest, you have to do basic activities, okay, and gradually increase your strength and stamina so that your ligaments will heal, your muscles will become strong, and then you can carry on with your sports activity.
Sure.
So a person from first 1 month of surgery will be at complete rest. Then he will gradually train himself to do his normal activities within the next 6 months. But when he wants to resume his sports activity, he'll have to undergo a vigorous training.
Yes.
Right? Because he has to condition his body for that.
Sure.
Now, what people fail that after a cardiac surgery, okay, we will just one fine day go out, walk around, we'll go catch a train, we'll catch a bus, we'll go for our jobs, we'll go for a trip, we'll go for some adventure activity. It is not true.
Is that desire to get back to normal life as soon as possible, but it's not advisable?
Yes.
Okay.
So it has to be a graded under supervision. There is a specific rehab protocol that we need to follow. Okay, there will be some kind of people who will just not do anything. They'll say, okay, fine, we are walking, we're doing our daily activities, we are happy with that. There will be a set of people who will follow the physiotherapist, who will follow the cardiologist, and accordingly he will do a graded program.
Sure.
And there will be a set of people who will overdo it. Okay, so it has to be done in moderation. Now, who will guide them? It's the physiotherapist who will guide them how to go about it. So initially, when you are in the hospital, normal routine things like going to the washroom, walking around the room, normally brushing your teeth, eating your food on your own, all these activities need to be achieved during that first week of recovery.
Sure.
After the surgery.
Sure.
Once you go home, the next 4 to 6 weeks is something where you are targeting gradual increase in walking speed, walking distance, so that by end of 6 to 8 weeks, you are able to walk at least 1 to 2 miles without any breathlessness, without any other symptoms, without getting tired.
But you're monitoring this.
You're monitoring it.
They keep
Because
coming back to you.
yes, because we do it, we monitor their pulse, we monitor their oxygen levels, we monitor their respiratory rates. If they are having any symptoms of angina means any heart pain or breathlessness or any other symptoms. So we instruct them when to stop, when not to stop, when to continue, when to push yourself, when to retreat. So all these instructions are constantly done under monitoring with us. There's consistency to be maintained. There should be some determination from the patient side, which we expect. So it is a consistent effort from their side as well as the physio effort, because they are constantly guiding them how to push them to a higher level.
Fair.
After that, after 6 weeks, then you start your strength training. Then you start increasing your stamina. So you go into a complete cardiac rehab. So aerobic training.
Okay.
So now what happens is people, tend to see all those videos on YouTube, like 5-minute workouts and 10-minute workout, and they go into vigorous workouts just on their own, which is not advisable. Because if you're a normal person like me or you, it's okay. You can just go through some videos and do it on your own. But when you have a heart issue, when you know your BP is not stable, when your respiration is not stable, you need to do all these things under monitoring. So when even we do it, we have the vitals which we monitor throughout the treatment protocol, before the exercise, after the exercise. We know when to increase the workload, when to increase the duration of the exercise. So that is a gradual program. We guide them to do it. And once you're fit and fine, after 3 months, once you're absolutely fine, you can go around, you can do whatever you want. But of course, some people might land up into doing extra activities like, going for scuba diving, going for skydiving. So all these things which are not recommended for them. So they need to take advice from the doctor before doing those things.
I can't relate to this. I have never in my life been accused of doing extra activities. that has just not happened for me.
So actually I'll give you an example. I know of a person, he had undergone a bypass surgery, and then he had undergone a proper rehab, proper everything followed by the doctor, physiotherapist. He had undergone a very good training. After 3-4 years, he started doing gymming. He started doing vigorous exercises, which is on their own.
Okay. That's
on their own,
to,
without any guidance.
Yeah.
So then they don't know when to stop.
Got it.
Okay, because they have already undergone a bypass. Their heart is not 100% strong enough. And of course, the age factor also matters.
Sure.
At the age of 60, you cannot do the same gymming activities what a 30-year-old is doing.
Fair.
So you need that moderation.
Yeah.
So overdoing also causes a lot of effect.
So what happened in this particular case with the overdoing and the gymming?
He died.
Oh,
because he got
Lord.
a second heart attack.
Okay.
Which could not be recovered. He could not be resuscitated, and he lost.
Well, that's tragic to hear.
Yes.
Or simply because he probably overdid it without it being monitored.
Yes.
Okay. So even 3-4 years later,
if
you're indulging in something excessive, one needs to double check.
Yes.
And so, Dr. Bhosale, actually, that's the direction I wanted to go in. Immediate rehab, 3 months, 6 months, even a year is all good. And then you get into a regular routine. The direction I want to go in is, how do you avoid, simply put, a second visit to the hospital? So there's patients that we've heard of that they've done the surgery, they've led a good lifestyle after that. Cholesterol levels are fine. But invariably, it's not just about that, right? There must be some lesser known risks also that one has to monitor. What are those?
I think taking over from Dr. Dhara, there are two important things I must stress before I come to your pertinent question. See, when we treat our patients and they are discharged, they undergo rehabilitation programs and achieve some active state for their routines.
Sure.
The question which we as medical persons and patient or relatives face, how do we keep away the second episode of the same event?
Yes.
And this is where what we label medical optimization is absolutely essential with secondary prevention protocols. What is medical optimization? See, most of these patients, they are not free of all medicines, even if they feel well.
Sure.
So you said they should avoid visits to the hospital by regularly visiting the doctor.
Okay. Valid point.
Because it is medical optimization which is essential and should continue to keep their body physiology or pathophysiology, as we call, in control.
Sure.
That is one thing.
Okay.
The second thing is prevention. How do we prevent? It may not be possible 100%, but at the same time, we can delay it or minimize the consequences.
It's like a best case solution.
Yes,
It's not 100%,
yes,
but it's best case.
Yes. So even if you can minimize the complications or consequences, I think it is a desirable action.
What does one have to do? What does one have to monitor for that?
Risk factors, I'll revise again.
Yes.
Risk factors which we see heredity or genetics,
Sure.
which is very dominant risk factors. And earlier also I have put the statistics. People born to parents with heart disease, both father and mother, they have 50% chance of developing heart disease after 40s.
Yeah.
One parent having heart disease diagnosed, confirmed, are likely to have 30% chance of developing heart disease after 40s.
Just one parent.
So you imagine here, one of your genetic constitution is making you prone to develop this disease.
Yes.
So you cannot take away your genes. You cannot
Absolutely
avoid what God has given you.
I'm born with it, I'll go with it.
But then in that situation, you must develop a lifestyle in terms of good physical activity, in terms of dietary modifications, which will keep your various dietary factors, cholesterol, lipids, sugars, in reasonable control. You must control your blood pressure. You must have stress-free responses in your day-to-day life. Your smoking habits, I'm stressing it, must go.
Fair. Dr. Dhara, I want to come to you about the stress element, but Dr. Bhosale, I want to go back to what you mentioned about genetics.
Yeah.
And so it's well established that a parent or both parents having a heart issue increases your chances to having them yourselves. But suppose there is a family history, but it is not at your parents' level. Is there some sort of statistic available there as to how prone I would be if that was the case?
I think it will be difficult to generalize the comment on this. But if your grandparents, we get our genetic constitution by apportionments.
Yes.
Say your parents give you 50-50.
Yeah.
That is genetic constitution.
Sure. So then grandparents becomes 25,
will
25,
become
25,
25.
Okay.
So, according to the level of your inheritance, you can assess your risk of getting that genetic constitutional disease.
And the same would apply broadly to, say, parent siblings. I mean, a parent sibling had a problem, but the parent did not.
So, it is ultimately the genetic distribution, to what extent.
It's maths, to put it very simply.
Yes.
Okay, fair enough. And then something to keep track of.
Yes.
If it's not just parents, even if it's grandparents or parent siblings, it's a red flag of some sort.
The risk statistics would differ.
Sure.
Differ. But there is a definite connection.
Okay.
Even with those siblings.
Dr. Dhara, let me take off from a point that Dr. Bhosale made about stress. Now, I realize it's one of those things that need to be managed, actively managed. But that is an external thing. I'm not inviting stress into my life. Okay, maybe sometimes I am. But broadly, this is an external factor. So given that stress is there and around us, and given the lifestyles that we lead, is there anything that one can do consciously to make life a little stress relieving, as it were? Just to release stress from the body?
Right. So first we'll look into what kind of stresses people face.
Okay.
So first foremost is the physical stress. Either, they are overworked or they are underworked because they are having a sedentary lifestyle. Then second thing is, emotional stress. There will be relationship stress. People are facing so many relationship stress, not just between partners, but, it could be a parent, sibling, peer pressures, social pressures. Many young individuals like college going and school students, they are also facing a lot of stress because of competition, because of the peer pressures. So they are also coming up with a lot of, suicidal cases and all. That is all leading because of the stress that they are facing.
Yes.
You have mental work-related pressures, because you have to meet your deadlines, you don't get enough sleep. So all these kinds of bad habits and lifestyles wherein you're not getting proper food, proper sleep, these will lead to the stress.
Absolutely.
So now, how do we tackle them? So first and foremost, because we cannot ignore them, because these are part and parcel of our life.
They're there, yes.
So we have to develop techniques wherein we can reduce our stress. So first, foremost, conventional technique is, have proper diet.
Okay.
Eat regular meals at regular intervals. Okay. Then have proper 7 to 8 hours sleep.
Okay.
Keep yourself properly hydrated. Okay. Take regular breaks during your work hours. So if you're working like 8 hours, you are not non-stop working. You should always take regular breaks. You should breathe yourself in. Okay, every 1 hour, just, have a 2 minutes break, have a nice conversation with your colleagues or your family members.
You're being too stern, yeah. 2 minutes in a whole hour. I'll take 15 minutes in a whole hour.
That's up to you. So then you should always, do some kind of meditation.
Yes.
Some kind of yoga activities. Because meditation also keeps your body calm. It reduces the mental stress that you're having. So even if you do just 10 minutes of meditation throughout the day is very good technique, to relieve stress.
Just 10 minutes is good.
Yeah, 10 minutes of meditation throughout the day is also a good thing.
But the point is to do it every day.
Yes.
Not when one feels
No.
one has
It should be
time.
consistent. It should be consistent.
Yes, fair.
Then we'll come to unconventional techniques like, having a healthy talk with your friends, going out for trips, going for family gatherings, going for recreational activities. If you like sports, you can go for a sports activity. Okay, if you like walking, you can do walking, you can do swimming, jogging, or, certain adventure activities. You go for an adventure or family trip or mountain climbing, but of course with monitoring,
Of
because
course. Of course.
only if the doctor advises you, you can go. You are fit enough to do all those activities, you can always involve yourself in such activities also.
Fair.
In fact, we recommend that, every 2-3 months you should go for a short trip, like a 2 days recreational trip. And in a year, you should have at least one long trip, because that really helps you energize yourself for the next phase of whatever workload you're going to face.
So, your medical point over here is 1 long break and 4 short breaks.
True, if possible.
आपके मुंह में घी शक्कर. What a fabulous concept.
I've recently, we are hearing on TV many companies saying that, you should have like a 40 hours weekday. You should have 56 hours work week.
No, we've reached 70, 80 also.
Yeah. So which is not good. I mean, you should get a break of at least 1 day. I'm not saying 2 days break, but at least 1 day break people should have, which
Absolutely.
people are not getting. Maybe in the corporate worlds we might be having, but if you see the lower class of people, they work Monday to Sunday.
Yes.
They have no breaks.
Yes.
So for them, going for trips with family, talking out their problems with the family is something which is very essential, because they are not going to get a physical break anywhere.
Yes.
But mental break is which they require a lot.
Equally important, if not more.
Yes.
No, I agree. Dr. Bhosale, let me come to you with a different perspective. In this whole rehab situation, we've heard of people dealing with anxiety issues, brain fog, memory loss. Does that mean that the treatment is not going well, or is this part and parcel and they will recover from it?
I think this is a deficiency of mental well-being.
Okay.
See, we are human beings, and
But
we
you're
have
saying even post-surgery?
Yes.
Okay.
Yes.
Okay.
We are human beings, and
Yes.
we definitely have mind.
Sure.
We think. We think for ourselves. We think for our family, society in general. See, when we think too much about ourselves, then you start noting deficiencies in your own life.
But Dr. Bhosale, how can I not think about myself?
Yeah.
In my life, I'm the most important person.
I'm coming to the different aspect of that.
Okay.
See, when you start thinking too much, that leads to, again, a mental issue. And in that situation, see, you should be under medical advices. But what one must understand and practice is that ultimately these things do happen. I am not the only one to whom it is happening. And then if I have to come out of my own life to a basic good living, I must take things in a different way.
That peaceful state of mind, you mean?
Yes.
Okay.
So, see, unless you yourself decide or you yourself have that understanding, you must have your life sorted out or peaceful or active. There are multiple aspects of life you have to think.
Sure.
So, we get many patients who say after heart surgery, they are not adequately rehabilitated. It is ideal to have good rehabilitation, and we see a patient going back to his normal lifestyle.
Sure.
But it does not happen.
So
in that situation, it is not our advice to persist on the same lifestyle. Then we advise retraining. And what is retraining? They say, I'll give you example of one public transport driver which I had operated. A robust fellow who landed with cardiac event, heart attack, and then he underwent bypass surgery.
Okay.
So following bypass surgery, we could not rehabilitate him to the same extent he would go back as a driver.
Got it. Okay.
Obviously, it was a risk to him and to the public by and large.
Yes.
So we refused to certify him fit for driver's job. Obviously, in that situation, a fellow would become depressed.
Yes.
Well, then we worked on his lifestyle and we wrote to his establishment that he should be retrained for a office job.
Okay.
And when he was retrained, that took hardly 2 months. And he started working in an office, just entering the numbers of buses,
Sure.
the driver, the conductor, their names, and what we used to call sorters. So from a driver, he was converted to a sorter.
Okay.
And that changed his life totally.
But that involved your proactive intervention to be able to help
Yes,
him out
that
in his
is
lifestyle.
that is obviously that is where a medical help is of importance. See, we cannot insist on our patients which we treat to have exactly the same lifestyle or same work pattern as they were doing in earlier period of life.
Sure.
So that is how things are.
Okay. So one has to take a lifestyle call at some point.
Exactly.
And this will not happen anymore. It needs to be different.
With lifestyle change, modification, retraining, and re-establishing. See, what is ultimately rehabilitation? I say it is a re-establishing your own well-being.
Yes.
So that is how the extended rehabilitation program works.
Absolutely. And so, Dr. Dhara, just from what Dr. Bhosale is saying, sometimes it's not just the physical therapy aspect of it. Sometimes it might include medical therapy, mental therapy.
Yeah, so it's actually a cardiac rehab team is not just about the cardiologist and the physical therapist. You have a lot of components. First role is of the patient. How motivated the patient is, okay, because he will be having a lot of stressors, he'll be having physical issues, so getting out of them. So motivation by self. Secondly, family support, which is very essential because family should be caring, they should be considerate, there should be help, not just physically but financial support also should be there.
Yes.
Because that also plays a major role. If
Absolutely.
that person is the only earning member, he's hospitalized, family is disturbed, it's going to add on to the stressor.
Yeah.
So in this, the other part comes the psychologist. Okay, sometimes because of all these emotional distress, they need professional help because this is not something in the capacity of the family to take care of. Sometimes they even need intervention of social workers, community workers, because they are the ones who will help them from outside.
Got it.
Maybe getting them a new job, or modifying their life issues. So all those things also it's not just about the doctors, also the nursing care, the people helping out, the ward boys and all in the hospital. Sometimes we will require extended care at home too. So those who are helping out in his daily activities, all those people will play a part and parcel of the cardiac rehab team. It's not just the doctors and the physical therapists.
Dr. Bhosale, let me come to you with diet. Now, we realize that there are certain foods, there's certain dietary habits that get us into a cardiac issue to begin with. But once we're out of it, we think low-fat diet is the best. But one, is that entirely true that if you just go low-fat, you're good? Are there any nutritional mistakes or oversights that we're making when it comes to rehab, post-surgery or post-intervention?
I think, as she has been stressing, moderation is the key. See, taking nothing of one nutrient and taking more of other nutrient, it will create imbalance.
Yeah.
See, ultimately, our body is not just carbohydrate or not just fat. We need proteins, we need vitamins, we need electrolytes. There are so many nutrients which are essential for body wear and tear.
Sure.
So, certainly there are components of the system which are responsible for causing enhancement of what we call atherosclerosis in the form of cholesterol. High cholesterol is more likely to have an effect on the blood vessels which develop those blocks. So if you talk of only one condition, that is cholesterol, it will have reflection in terms of developing blocks. But at the same time, if you totally avoid fat, you are losing on the vitamins, which are what we call fat soluble vitamins, like vitamin A, vitamin D, E, K. So they are essential ingredients of our body physiology. Their deficiency is going to again have various deficiency disorders.
Fair, yeah.
So just for one side effect of that fat diet, you cannot delete it from the diet and cause other deficiencies.
Fair.
Ultimately, it is the balance.
Where are you on Kaju Katli in moderation?
Kaju Katli, see, it has lots of carbohydrate, lots of fat.
It's starting to sound like you're not recommending it. This is not working for me.
Nowadays, we don't get pure Kaju Katris. I feel people
So-
are using
so-
peanuts.
So, see, if you are allowed 1 teaspoon of sugar,
Yeah.
it is going to give you 5 calories.
Yeah.
But 1 teaspoon of ghee or oil
Yes.
gives more than double of that.
That is fair.
So
That is fair.
ultimately, you have to keep in mind what are your requirements.
No, I was just trying to slip that in so that if I had a positive answer, I could show it to my wife. But it's not working in that direction.
No. So taking 1 or 2 Kaju Katri is, that is 8 to 10 grams of sugar.
Yeah.
You must have your own calculations
Yeah.
as to where your body is.
I do have my own calculation and it's not looking pretty, to be honest. But Dr. Dhara, let me come to you with this. From a rehab perspective, now there's this whole thing that lack of mobility, sitting at your desk for 8-10 hours is sometimes the problem.
Yeah, true.
But now we're talking about someone who has undergone, let's say, a major surgery. Then mobility itself becomes a problem for that person. How do we solve for that? What are those little things that one can do to get mobility going, even though it has now become more difficult?
Okay. So, like in severe cases when a person cannot even get up on his own, what we can do is initially start off with something called bed activities, wherein you're moving your limbs, you're doing all your techniques within the bed. Then you come to sitting position. So in sitting, nowadays people modify a lot of things. So we have sitting aerobics. So people are doing sitting aerobics. They are
Okay.
sitting on their chair and doing the aerobics. You don't even have to get up and do. So
Okay.
these are simple things which people can do, like in the chair itself.
Okay.
Then you can do all your breathing techniques, your meditations and everything in bed. You don't require to walk a lot for that. Taking regular breaks is very important. Every 1 hour, even if it's an old person, okay, we always recommend every 1 hour, just get up, walk in the room 1 round and come back and sit.
Okay.
Or if a person is very lethargic, he doesn't want to do anything on his own, a small motivation like, I will not give you water, you get up, go and get your water.
Yeah.
Okay,
Yeah.
I will not give you this, you go and get up and take your own things.
Sure.
So some motivation like that, they can just get up, go take the things, because for their daily essentials they will have to get up.
Yes. Fair.
So
Fair.
that
And
small
sometimes just that is
modifications
enough.
can be done.
Okay.
Getting motivation from like for old people, it would be getting motivation from their grandchildren. So grandchildren can just say that, Dadi, let's go down. I want to play. So you just come and accompany me. That is also a small physical activity for that
Fair.
person. So those modifications can be done. Then we have static cycles which are available. So even if you cannot walk, you can sit and do a cycling program.
Yes.
So,
Yeah, those sitting cycles are there.
Yes,
You're right.
yes.
You're right.
So
Yeah.
those things also can be accommodated if you don't want to walk much.
Fair. Okay, so each one finds their level, but the way to
Yes.
find that level is probably to have a conversation with you, for example.
Yes, yes.
Just so that you can find the right balance.
Right.
And on the subject of balance, Dr. Bhosale, medications, and sometimes these are heavy medications, as it were, beta blockers. There are side effects, dizziness, and things like that in some people. How do you manage for that? That the treatment doesn't get affected, but they're also able to manage the side effects. How does one do
This
that?
is what we call medical optimization.
Okay. Okay.
See, medicine is all about some or other drug, along with diet, physical activity, few restrictions here there. When we talk of especially the cardiac medications, they are effective medications. When we say effective medications, their efficacy tells us if a little higher dose goes, it will have side effect in the adverse way. So it is the dose related adversity is what we have to balance.
Fair.
See, those who do not tolerate at all any dose, it's a different thing, what we call hypersensitivity to that drug. Obviously, that is always avoided. But majority of the cardiac drugs, they need dose adjustment. And dose adjustment to bring optimization in terms of the effect of that drug to achieve control of blood pressure, control of heart rate, effective pumping of heart. So all these are definitely dose related and can be optimized for given individual.
So it doesn't necessarily mean a change in medication or a stoppage of medication. It's just a change of dose.
Yes, except when there is a issue of hypersensitivity.
In which case that you just have to stop and find something else.
Then there is no way but to stop the medicine.
Okay. There's two things I want to address with you, Dr. Dhara. One is weight management, where again, much like a cholesterol issue or a hypertension issue, sometimes weight management is the problem. Then one does a surgery or an intervention, and then it becomes more difficult to manage weight. So how do we adjust for that? And two is we worry about diet, but hydration is an equally important part. How do you, as a physical therapist, as a physiotherapist, manage weight issues and hydration issues, and what is recommended?
So about the weight management, so the initial phase, it's all very supervised because you're not able to do, your basic routine activities. So the first focus will be to get into a normal lifestyle where you're able to do your daily activities, your daily routines without any assistance or without getting tired, without getting breathless. This will be your first target.
Okay.
Then comes the next phase, like, after 6 weeks, when the person is stable, the vitals become stable, the heart has healed. Then we start with the weight management. Okay. So weight management first foremost will be the diet modifications. Okay. Sleep is very important because that also affects the body weight. Stress levels you need to manage because stress will also indirectly affect the weight. Then comes the workouts. So workouts should be graded. Okay, it should be regular with intervals. Okay, and it should be well monitored. You cannot just do randomly anything and everything on your own. So you should first start with strength training, start with stamina increase. Okay, and then gradually go for heavy aerobic training.
Okay.
Start with 5-10 minutes of warm up. Okay, then you do a cardiac rehab for 30 minutes. Then you go again for a cool down. Then you do normal stretching exercises, some meditation for 5-10 minutes, or some breathing exercise for 5-10 minutes. So although you're working out for 1 hour, you're dividing your pattern in such a way that you are doing strength plus warm up plus stretching plus aerobic plus relaxation. You're incorporating this as a whole. And don't, people just want to follow the film stars, they go on crash diets, they go on crash body workouts. These things don't work for normal individuals or for individuals who have undergone such surgeries.
Absolutely.
So you should do it with moderation under guidance and supervision.
Absolutely.
Okay. Once you're fit and fine after 6 months, then you start your regular jogging, swimming, all your daily routines. So these also help in weight management. So all these recreational activities also you can incorporate in your life. Just not doing a body workout in the gym. That is not the only thing.
Absolutely.
You can do other activities wherein you are using your physical abilities.
And you grade it upwards.
Yes.
It's not something you
yes,
start
not
immediately.
something that you start on day one. You have to gradually progress it from 0 to 100. That way.
And you mentioned how diet is such an important element in terms of rehab and just general weight loss. I mean,
Right.
but we think of diet as food. We don't think of it as hydration.
Right.
And I'm sure that's a crucial element.
Yes.
And how does one
yes.
calculate for it?
Yes. So, see, usually, for normal individuals, they recommend that 1 to 2 liters of water, around 7 to 8 glasses of water, should be taken on daily basis. But, in cardiac patients, I think Dr. Bhosale will be able to throw a light upon it in more details. Some people do have to be given a water, since they have a lot of water retention, they need to fix up restricted water intake.
Oh, okay. This is the other way then.
Yes.
Okay.
So it is both ways. Some people will be recommended to drink more water because that will help you, with your intestinal systems coming up. That will help you relieve your constipations. There will a lot of heat generation, and because of that, because if your water volume is less in the body, the heart will have to pump blood more.
Yes.
Okay, because it is putting an extra effort on the heart. So if a proper volume of water is maintained, there will be good volume of blood. So that will help with easy circulation.
Fair.
Okay, but in some people there will be fluid retentions. So in such cases, they will have to restrict the water volume.
Fair.
So whatever your doctor says, you need to follow it accordingly.
Absolutely.
You cannot, just randomly. Some people will say that, I drink 4-5 liters of water a day. For what? It's not required for your body.
There is some such thing as having too much of water, as is true for almost anything. Yeah.
So nothing too much, nothing too less. It should be in moderation according to your body mechanism.
Absolutely. That is on the hydration side.
Yes.
I want to ask you about inflammation. Inflammation is crucial, but it's not discussed as much as cholesterol, for example. But there is
it's a new concept now. When we talk of inflammation, that means the body tissue which is affected under inflammation becomes swollen, becomes function-wise less efficient. Talking in terms or in context with cardiovascular system, we have vasculitis, which is inflammation of the blood vessels.
Oh, okay.
We have cardiomyopathy in terms of heart muscle. So these are serious situations. Because in vasculitis, see, when the blood vessel is inflamed, the lumen of the blood vessel reduces. So that will allow less flow of blood going across to the target organ.
Sure.
So there is a blood supply mismatch. When there is blood supply mismatch to any organ, the organ suffers less blood supply changes, what we call ischemic changes.
Okay.
So these ischemic changes for any organ are not good. Or if they cross a limit more than 50%, they create serious consequences of infarctions.
Fair. So there is an ideal level, and the idea is to get to that ideal level.
Yes.
Okay.
Similarly, on the heart side, you have myocarditis, cardiomyopathies, which influence the contractility or the pumping of the heart seriously. When a contraction of the heart is seriously affected, obviously the contraction is less, so the output of blood volume and the pressure with which the blood is pumped gets affected. And that will result in organ
damage,
what we call malperfusion.
Okay.
The organs do not get adequate blood flow for their function. And obviously, malfunction will come if the deficiency persists for a longer period of time.
So, sir, what causes inflammation and how do I deal with it?
I think that is little complex question.
Okay.
So when we talk of inflammatory pathology, the processes, there are multiple aspects. The common, not easily understood, is a autoimmune inflammation. See, when the body system works, there are elements which quite often, the antigens, the proteins which are circulating in the blood, cause antibody reactions. So there are something autoimmune means auto means self.
The body itself is creating a
Yes,
problem.
the immune system of the body itself creates few protein components which we call antibodies, and these antigen antibody complexes create this autoimmune inflammation.
Okay. But if it's autoimmune, then it's not easily resolvable.
It's not easy to treat. One, even if it is treated, the recurrence chances are very high. So it becomes a chronic, recurring disorder.
Fair enough. No, I can imagine. Let me wrap this up by asking both of you all, and Dr. Dhara, let me come to you first. Just given new learnings that we've had, that even within the medical field that you all are learning on pretty much a regular basis, right now from a cardiac rehab point of view, what are the top 3 things that I should be looking at? And if 1 or 2 of them are unconventional, feel free to state that also, because they become mainstream in time. But
Right.
you get to see the first version of it, as it were, basis what you do. So what are the top 3 things I should be careful about?
So the first topmost thing is try to avoid or try to get over your stress levels. Have a healthy diet. Okay, a lot of junk food people have, frozen foods. They will say, I have only paratha and sabzi, but those are all frozen foods. You don't know what preservatives they're using.
Yes.
People use a lot of microwave to cook food nowadays. So those are unhealthy techniques. People might say that I to eat ghar ka hi khana, but they are eating all fried foods at home.
Yes.
So all those things are also something that you look forward to. It's not just, having regular meals, but what you're eating, what not you're eating, and how much proportion you're eating. Second is sleep, which is very important. People don't, people are working even at night. I see people online throughout the day. I mean, at night also, if 3 o'clock you wake up, you see their laptop is on, they're working something.
Yeah.
So, which is a very bad practice. You should have a 7 to 8 hours of proper good sleep that you say. Then, of course, having a family time.
Yes.
Okay, that is very important. Every day, half an hour in a day, just play with your kids at home, or just have a recreational activity at home. You can go out with friends, play games. Simple things like playing games is also something which relieves the stress. So we can involve ourselves in all these things, taking trips, not just, eating khane pine wala trips, but of course going out for adventure trips wherein you are actually doing some physical activity and plus relaxation. So if you're going to a beach, but you can take some activity like, scuba diving or something like which you will have one physical activity with relaxation. So
and
you can...
the thing is that these are all so basic and so obvious, but we don't focus on them. And if we're not conscious about them, to our own detriment, we are suffering. I mean, that is a sort of tragedy of it. But the consciousness of sleep enough, have a work-life balance, take some time off for yourself. Mental health is as important as physical health.
Nowadays, people talk a lot of me time, but me time is like they go out and sit with their phones. That is not the me time. The me time is you should meditate, or you should just relax, go out, just don't think anything, get out of the stress. That is more important. If we are watching a movie also, what happens is people tend to take that stress. Oh, what happened in the movie? They'll try to connect with their personal life.
That's interesting.
So that is not something good. Rather, don't watch such movies.
Me time is eliminate external stimulation, whatever that stimulation is. Be with yourself.
Me time should be basically you're not thinking anything.
Yeah.
Not your work, not your family, not your kids, nothing. It should be your own personal time where you are spending time with yourself. Sometimes, people say all those Reiki and all those things, these are something which we never focus on. But these things, kinds of things, sometimes they really help you get out of that stress level.
I completely agree.
So you can try. There is no harm in trying all those things also.
No, absolutely. That your definition of me time is really striking a chord with me. I appreciate that. Thank you, both of you all, Dr. Dhara, Dr. Bhosale, for doing this with us, for enlightening us with your knowledge, and for everything that we have learned in the course of this conversation. Thank you very much.
Thank you so
Thank
much.
you. Thank you.
Recovery isn't just about surviving a heart attack. It's about thriving afterwards. A huge thank you to Dr. Krishnarao Bhosale and Dr. Dhara Parekh for shedding light on the steps that can make all the difference in preventing a second heart event and leading a healthier life. If this episode helped you see your heart health in a new light, don't keep it to yourself. Share it with someone who needs to hear this. You can watch the full episode on YouTube, Spotify, or your favorite podcast platform. Until next time, remember, the journey to a healthier heart starts with the right knowledge and the right actions. In the heart of Mumbai stands a name trusted by thousands. Over 1 lakh heart procedures, 200 plus years of combined experience. From diagnosis to recovery, your heart gets complete care under one roof. Because when it comes to your heart, experience isn't optional, it's everything. Zynova Shalby Hospitals. Experience you can trust, care that you deserve.